What do different brain MRI scans show in lung cancer? Imagine trying to see tiny details inside the brain that could tell us if lung cancer has spread there. Brain MRI scans are powerful tools that help doctors do just that. They are especially important because lung cancer often spreads to the brain, sometimes before symptoms appear. Detecting these metastases early can make a big difference in treatment and outcomes. The main purpose of a brain MRI in lung cancer is to find out if the cancer has spread to the brain. Up to 40% of people with advanced lung cancer may develop brain metastases. An MRI can reveal these tumors as areas of abnormal signals. When contrast dye is used, it makes the tumors stand out more clearly. This contrast-enhanced MRI is the most sensitive way to find even small or multiple metastases. It helps doctors see exactly where the tumors are, how many there are, and how big they are. This information is crucial for staging the cancer and planning the best treatment options. There are different types of brain MRI scans. The standard is the contrast-enhanced MRI, which involves injecting a special dye into a vein. This dye highlights tumors and makes them easier to see. Sometimes, a non-contrast MRI is done, but it is less sensitive for detecting metastases. Advanced MRI techniques like diffusion-weighted imaging or perfusion MRI can provide more detail about the tumor's characteristics, but they are not typically used for routine screening in lung cancer patients. In lung cancer patients, MRI scans can show metastatic tumors as areas of abnormal signal inside the brain. These areas often have surrounding swelling called edema. The contrast dye helps to clearly define the borders of these tumors. MRI can also reveal how many metastases are present, their size, and the specific parts of the brain affected. For early-stage lung cancer, routine brain MRI is usually not necessary because the chance of brain spread is low. However, in more advanced stages or certain tumor types, MRI can detect hidden metastases that other imaging tests might miss. When MRI detects brain metastases, it often changes the cancer's stage to stage 4, which is more advanced. This information influences treatment choices, such as targeted therapy, immunotherapy, radiation, or surgery. Detecting metastases before symptoms develop allows for earlier intervention, which can improve quality of life. Doctors also use MRI to monitor how well treatments are working and to check for new or recurring tumors over time. While MRI is highly sensitive, it does have some limitations. It is preferred over CT scans because it can detect smaller metastases and provides more detailed images. However, MRI may not be suitable for everyone, especially those with certain implanted devices or allergies to contrast dye. PET scans are not ideal for brain metastases because the brain's normal activity produces signals that can hide tumors. The frequency of brain MRI scans in patients without symptoms varies, but in advanced lung cancer, yearly scans are often recommended to catch new metastases early. In summary, different brain MRI scans, especially contrast-enhanced MRI, are vital in lung cancer care. They help detect and characterize brain metastases, which is key to staging and treatment planning. While routine MRI scans are not always needed for early-stage lung cancer, they are essential in advanced cases to identify brain involvement early and guide effective management. Always remember, if you or someone you know has lung cancer, discussing with healthcare professionals about the best imaging approach is the safest way to ensure accurate diagnosis and personalized care.